First aid for drowning. Now, if somebody has drowned, there are lots of dangers to consider. With water like this, you don't know the depth. It could be really cold, and you've got to consider your competence. On this occasion, I know that the water's shallow, and I'm a competent swimmer. So I'm going to go and get Lucas, and we'll find out what to do if someone has drowned. Now, if your casualty is unconscious, we need to place them in the recovery position. And that's the same for any first aid situation where somebody's unconscious. But also consider temperature. They're going to be very cold. Get a blanket on them, and if you can, get one underneath as well. One underneath is worth 4 on top. Now, if your casualty is to stop breathing, roll them on the back and start CPR. But for someone who's drowned, whether they're an adult or a child, we need to start with 5 initial breaths. Tilt the head, pinch the nose, and blow 5 times, short, sharp breaths. And then carry on with CPR as normal. Now, if your casualty wakes up, Lucas, come on mate, let's get you to safety. We've got to take these wet clothes off. It's better to be naked and dry than clothed and wet. And keep them warm. Maybe get someone to give them a hug and wrap them up in a blanket. If somebody's head has gone under the water and they may have drowned, consider secondary drowning. They may have breathed some water into their lungs, and later on they might have flu-like symptoms and they might struggle to breathe. So get them checked out in hospital as well. That's what to do if someone has drowned. Let's keep you warm.